Iași is a modern industrial university city located in the very east of Romania, near the Moldovan and Ukrainian border. The city is home to the best medical university in Romania, which recently hosted a very special event. It was here that the world's best dental implantologists came together for their very first international World Championship. For those organising the event, it proved to be quite a challenge.
Well, there was a lot of organisation, of course, necessary for the local organisers, for the colleagues who are working here in Iași. Then the qualifications had to be done. We had to get also visa for a lot of participants. Actually, one team didn't get visas. They will participate through Skype, and we've sent a referee down there. So it was complicated. It's complicated because participants come from so many different countries also.
The participating implantologists came from across the globe. Even individual teams had members from many different countries.
Well, keep in mind our team is from Belarus, from Czech Republic and from Germany, so it's an international tournament.
The dental procedure being used at this World Championship was developed by Dr. Stefan Ide, and the total treatment time is around 72 hours. After just 3 days, patients can chew as normal using their new set of teeth. With other implantation methods, this can take months, if not years, to achieve. To contend at this high level presents a special challenge to the championship participants. Here's a first glimpse at the challenges ahead.
I think it will be very tough competition. I know that the best implantologists from this world are coming to participate, and they will do their best.
Looking at the preparation of the championship clearly shows that CAD/CAM operation aids were not part of the plan. What was the reasoning behind this?
Well, these devices are, of course, allowed, but they consume a lot of time. We have a time limit in this World Championship. This is 65 hours. After 65 hours, the treatment must be finished, the bridge must be finally in. And if we would use these CAD/CAM devices, make a 3D plot, drilling stand and so on, I guess this would take a day extra. This means we would lose a day of these 65 hours, and there's no way that we can do it. I mean, anyway, those surgeons who are here, they are extremely experienced. I mean, they simply use their hands and their eyes and their nose to find the bone, and I don't know any of the real specialists using these templates. You know, I mean, we know what we are doing.
And what about other preparatory work? Were the participants allowed to view x-rays of the cases they would treat as part of the championship?
No. Nobody of the participants was able to know with which case they will have to deal tomorrow.
Expectations are high and the teams are excited. The very first International Dental Implantation World Championship can begin. It's 9 o'clock on Monday morning. All the participants are at the clinic and the patients are already in the waiting room. The first x-rays are being taken and strategies as well as procedural approaches are being discussed. The operation theatres are kitted out to the very highest standards and lie ready for today's patients. The final preparations are completed and the participants begin operating. The patients are treated in 3 different operating theatres. As mentioned earlier, the implantation technology being used is one which was developed by Dr. Stefan Ide. The implants come from Ide Dental and were specifically developed for this treatment method.
I start to use these implants, this system. I can treat it much easily, much faster, and I found many people which are very happy with use the Ide system implantology.
The operations are now well underway. Let's take some time to hear from some of the implantologists participating in the championship. What makes your treatment method different to other such implantation procedures?
Of course, the first difference in time that we are now waiting for 4 to 6 months for osseointegration. Number 2, we walk, no surgery, no sutures, no blood, no swelling after the operation.
Can every patient, irrespective of their medical circumstances, be treated within 3 days?
Of course. As I told, around 99.9% cases we can complete it within 72 hours, within 3 days. And in medical science or in dental science, there is nothing like 100%. That's why I always say 99.9%.
Why should patients choose this method of treatment and technology?
This technology is very comfortable for the patient. I think it's minimal invasive, so the patient doesn't suffer too much. Everything is getting finished in 3 days at least. And there are no such big pain after this intervention, and I think it's the best way to do it. So the patients will have just to know that it's possible.
The treatments for today are finished and the implants are in place. The patients are free to leave. So how did the operations go?
I think all the operation is okay. First one, it was a little bit more heavy because of the teeth. The teeth were very rotten. We had to take all them out, so we found some difficulties in taking teeth out. Otherwise, implants are placed good in the corticals, everything is fine. We managed to do them, so I think it's fine.
Just 24 hours later, the patients arrive back for their next appointment. In the meantime, the dental laboratory has been busy crafting precision dental metal bridges. Only the world's best dental technicians are taking part in this first international World Championship.
We have to make models regarding the impressions, and then we start to modulate the frames. Now we are working on metal. For us, it's really hard work.
The next day, Tuesday, 10 a.m. After just 24 hours, the precision-made metal bridges have arrived from the dental laboratory. The patients have been called back and are ready and waiting in the dentist's chairs. The metal bridges must now simply be fitted into place.
Yesterday, of course, we operated this patient 18 implants on the championship, and now I think he's feeling good because I see no swelling, nothing. I just want to ask him, please, how do you feel today after 24 hours?
I'm okay. I'm no pain.
No pain, nothing?
It's very fine.
Okay.
Back in the dental laboratory. The teeth must now be fixed into place on the metal bridges. Ceramic or synthetic materials can be used depending on the situation. Precision work and many years of experience are essential for this type of work. The work of the implantologists, as well as that of the dental technicians, is being judged at this World Championship. It's 9 a.m. on Wednesday, day 3 of the first International Dental Implantation World Championship. Patients, who in the meantime have been completely pain-free, are waiting excitedly for the big moment, their final fitted bridges. After just 72 hours, all of the medical and dental work has been completed. A big day for all those involved.
We just finished the treatment. We just fixed the teeth, and the patient will go home now, and since now he can simply eat any food he wants. There was no any swelling. The patient reported that he feels good. Later on, we only will need to see him for the control checkups.
It's clear to see that the patients are delighted with their new teeth and extremely grateful to the implantologists. No other procedure can produce such convincing results and in such a short treatment period. Compared to other painful and protracted implantation methods, the issue of cost is also unique. The procedure costs are just a fraction of that of other methods. This dental implantation procedure, developed by Dr. Stefan Ide, is unrivaled in every aspect and is the best such treatment worldwide. It's Thursday, 10 a.m, and the first International Dental Implantation World Championship has come to an end. All of the participants are taking part in a debriefing session, where all the cases and solutions are presented in detail once again. Experiences are exchanged and the work is evaluated. Prize-giving ceremony is just a few hours away. Each and every implantologist and dental technician has demonstrated their ability several times throughout the championship. The final can begin.
Dr. Vivek Gaur, world champion in the discipline extraction. Dr. Alexander Lazarov, world champion in the discipline Congratulations.
Thank you.
Dr. Mayur Kainar, world champion in the discipline extraction. Calapod Andrei, world champion in the discipline segments in both jaws. Dr. Florin Frateanu, world champion in the discipline segments in both jaws. World champion in the discipline regular cases with no extraction. Congratulations.
The teams have competed in 5 of 7 disciplines. 4 teams have made it through, while 1 team has been disqualified. This shows once again the high standards present at this first International Dental Implantation World Championship. The participants and teams have packed their bags and it's time to leave. Dr. Ida gives us his final thoughts.
Yes, it was a very tough week. It was a very interesting competition. All the teams gave their best. We tried very hard to help the patients. We had very complicated cases. In the evening we always sat together, we were discussing the cases. Actually we had more patients to treat than were needed for the competition. In the end we had to do 21 jaws, but we helped them all, we finished it all. Also thanks to the dentist technician who did a real great job. It was all really perfectly organized, and our team definitely will try to be in the competition also next year, so we will try to qualify again for the immediate loading World Championship.